Day 4 Colorectal Cancer Awareness Month. Here we go. If you're seeing blood in the toilet, it's not normal. It's not always bad. But here's what you need to know in terms of, is this just hemorrhoids or is this something else? Here's what hemorrhoidal bleeding is typically described as. Painless bleeding with bowel movements. I have a hard bowel movement or a regular bowel movement. There's a little bit of blood in the toilet. There's blood on the toilet paper, and that's it. There can sometimes be a little bit of discomfort, but it's generally not painful. Sometimes you can also feel some itching or some burning, but that tends to go away probably about 15-20 minutes afterwards. If you are having severe pain with bowel movements, it is unlikely to be an internal hemorrhoid causing that bleeding. It could be something else like a fissure. If this is severe pain with bowel movements, it could be something like a fissure, but that pain also tends to get better with time, about 15 to 20 minutes after a bowel movement. If this is pain between bowel movements or pain that sticks around for a long period of time, and you're having pretty severe bleeding with bowel movements, this is something that would strike me as being a little bit more concerning. Does this bleeding come with other symptoms? Are you having unexpected weight loss? Are you suddenly unable to tolerate eating as much food as you used to? Are you straining to have bowel movements? Any other associated symptoms with rectal bleeding is definitely a reason to get checked out. Get checked out, what does that mean? You tell your doctor. Usually what will happen is you'll get an exam and then probably get something like a colonoscopy. If the bleeding is getting worse, if the pain is getting worse, if you have persistent changes in bowel habits, please go get checked out, get yourself a colonoscopy, and make sure you don't ignore these signs. If you are in the Houston area, please come see me, Houston Community Surgical. I usually have same day or next day appointments. We can get you screened within a week.